Hi, I'm Jacob Christenson, CEO of Radix Recovery in Cedar Rapids. And today I want to talk about something that affects far more people than you might think. Dual diagnosis, or what we call co-occurring mental health disorders. Dual diagnosis means that someone is dealing with both a substance use disorder and a mental health condition at the same time. This could be addiction combined with depression, PTSD, anxiety, bipolar disorder, or any combination of the two. It's incredibly common, but it often goes untreated because many people don't realize that both issues need to be addressed together, not separately, for true recovery to happen. At Radix Recovery, we understand that you can't treat addiction without also treating the mental health challenges that fuel it. And you can't effectively manage mental health if substance use is still active. That's why we offer integrated dual diagnosis treatment, a model that brings mental health care and addiction treatment together in one comprehensive, individualized plan. When both conditions are addressed at the same time, the chance of long-term recovery increases dramatically. When you come to Radix Recovery for dual diagnosis care, you're not treated like a label. You're treated like a whole person. We begin with a thorough assessment to understand the full picture of what you're dealing with. From there, we build a customized treatment plan that might include cognitive behavioral therapy to change the thought patterns driving both addiction and mental health problems, dialectical behavior therapy for emotional regulation, distress tolerance, and managing overwhelming emotions, individual counseling to dig deep into both addiction and mental health triggers, group therapy to connect with others who understand what it's like to face both challenges at once, and family therapy because healing often needs to happen at home as well. Our licensed clinicians work together to make sure your care is coordinated, consistent, and designed just for you. Here in Cedar Rapids, we regularly work with clients who are dealing with co-occurring conditions like substance use and depression, addiction and generalized anxiety disorder, PTSD and drug or alcohol misuse, bipolar disorder with co-occurring substance use, personality disorders alongside addiction. If you've ever felt like no one really understands everything you're going through, or if treatment in the past didn't seem to stick, it could be because only half the problem was being treated. One of the reasons dual diagnosis is so important is because addiction and mental health feed off of each other. You might drink or use to escape anxiety, but that escape deepens the depression. Or you might feel so overwhelmed with trauma that substances feel like the only relief. Our goal is to break that cycle by helping you develop healthy ways to cope, rebuild your identity, and learn to manage both your mental health and your recovery with confidence. We're not just another rehab center. We're a team of licensed professionals who understand the complexity of dual diagnosis. Our approach is clinical and compassionate, combining proven treatment methods with a deep commitment to seeing every client succeed. We walk with you through the hard moments, we help you find clarity, and most importantly, we help you heal on every level. If you or someone you love is struggling with both addiction and mental health challenges, don't wait. These issues don't get better by ignoring them. They get better with the right kind of help. Call Radix Recovery today to schedule a free assessment and take the first step toward true healing. You are not broken. You are not alone. And with the right care, you can recover fully.